I am Karen Sinescu here at the Center for Surrogate Parenting. I'm going to talk about the medical pillar of surrogacy. At CSP, we comply with the 6 pillars of surrogacy. The first pillar is medical. Intended parents that come to our program must have a medical reason for participating in surrogacy. With regards to surrogate moms, we need you to get a copy of all of your OB records. So you need to go to your obstetrician and get a copy of all the records for all the births that you've had, and we do need a complete copy of those records, please. Once we've got the records, we will review them, and then we're going to send you to an IVF doctor for a full evaluation. When you go to the doctor, he's going to do an intake on you first, then he's going to do a full physical, and this will include looking at your uterus. So we are looking to see whether your uterus is a really good looking one, all right, whether your uterus is normal, or whether we have a potential problem.
Hi, I'm Margie. I'm the medical administrator here at CSP, and some of the common questions we get from potential surrogates are, can I be a surrogate if I've had my tubes tied, or if I have an IUD, or if I have the Essure coils? And yes, you can. It doesn't matter that you've had your tubes tied. If you have an IUD, we just need to remove it, and after you've had a couple of cycles, that'll be fine. And for the Essure coils, we just make sure that you have an HSG. That's a procedure where the doctor looks in the uterus to make sure they're in the proper place and it won't interfere with a subsequent pregnancy. We also get questions about, do you need all my old OB and delivery records? And yes, we like to get as much information about you as possible. So even though your children might be older, it could be more difficult to get those records, but if you can't, we just need to know that you've tried. We try to get as much information as possible to pass it on to the IVF doctor, and he will make that determination.